Hello, 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 everybody. This is Irina Strunina, and this is our weekly podcast, Diabetically Speaking with Smart Move 360. This is the place where we meet every Thursday at 4 p.m. Eastern Time, and I invite my guests to discuss different aspects of life with diabetes. Usually, I am inviting experts. There may be doctors, there may be dietitians, there could be social workers or life coaches, different people who on daily basis meet with people with diabetes and they see their challenges and they're helping them to avoid complications or deal with complications. And this is the podcast that I have. We have a YouTube channel. It's called Smart Move 360, and I have the playlist there, which is called Diabetically Speaking with Smart Move 360. So feel free to go there and first of all subscribe and like and watch the previous videos because this is already third season as we exist. So we have quite a few videos there. And as I said, on Thursdays, I usually invite experts. On the very last Thursday, I invite people who live with this diagnosis, and we call those Warriors editions. So that the story, life stories from people who experienced that diagnosis from inside out, and they talk about their struggles and they talk about their aha moments. So everyone, please check this out. Something you may learn, something you may find out that will be helpful you to cope better with the stress that this diagnosis brings. But today I have an expert. I have Dr. Tia, and we met with her a few years ago. As we learned, we don't remember how many years ago. So she is a great person who found our Facebook group because her passion of helping people to eliminate the complications that diabetes can bring to you. And Dr. Tia, please welcome to the show and please introduce yourself and tell us who you are, what you are doing, why you found our group, and how you're helping people with this diagnosis.
Irina, it's so nice to be here. And I think you're right. 3 years ago, I was searching the web to find a support group because the pathologies that people who were diagnosed with prediabetes, diabetes, and even end stage, where they end up on my operating table needing some level of an amputation, it just felt really necessary to find a group of people who were dealing with the same thing so that they can share resources. We can only do so much as professionals. You meet the doctor once a week, once a month, but in between those times, there's things that you can do. And so I'm a podiatrist here in Santa Cruz, California. I own a privately owned independent medical practice, taking care of people with foot complications, foot problems, and hopefully I try to draw them in earlier than that through preventive care. Now, excuse me for a little bit. I'm getting through some throat issues in the last week. I'm recovering, so I might be a little bit raspy. This is one of those topics that I deeply enjoy talking about because it wasn't until in my fellowship and when I finished in 2015, a fellowship is an advanced year of focalized training. So in that additional year of surgical training, I was selected for a position to be in a community hospital treating people who had foot complications. And oftentimes it was a surgery, and I was performing surgery many times a day. I think the most surgeries I performed in one day at this community hospital was like a 13 patient day, 13 surgeries in people who had foot complications. What a lot of them said when we came to that point and I had to consent them for surgery was that they didn't know how important their foot health was.
Mhm.
And so it's alarming to hear that at the end stage. And so once I left that training site, I knew there was so much more to do as a podiatrist. And that's how I ended up over here, wanting to talk to people who are recently diagnosed or people who have been diagnosed, and maybe they haven't been getting the foot and ankle education that they needed. And unfortunately, in our healthcare landscape, there isn't a lot of time to spend with each and every single patient who needs our attention. And so,
Yes.
being able to step away from the mold of insurance of the 7-minute medical visits
Mm-hmm.
allowed me more depth with each patient. So instead of seeing hundreds of patients at a time, I get to focus on just a few. And hopefully, through those few that I can help, they become ambassadors to continue to educate their circle, their network, and their community. Because, one of me can only serve so many people, but the
Absolutely.
people that I serve, I hope continue on to help others, their neighbors, their friends, their family members, their loved ones, to tell them something as simple as, "You gotta see the podiatrist."
Yes.
And so that brings me here today. So I'm so glad that we're here together and finally talking. I really thought we've been talking all this time. I really
Yes.
thought I'd already been talking, but I think we talk about so many different things. We've
Yes.
crossed paths so many different ways, but we can get straight into the importance of foot health as it pertains to those who have diabetes.
Yes, absolutely. And again, thank you for finding our group. Thank you for being vocal there. So I know and people who are active enough in our Facebook group, they see that very often when people come up with the questions about food health, I would tag you and like, Dr. Tia, do you have anything to add to whatever is already said here? Because um, we have a lot of self-proclaimed doctors and experts, but very often on a simple issue that people might have, we could see such a varieties of recommendations, and some of them are more hurting than helping. And but this is because everyone is different, and I personally believe that we cannot apply the same thing to everyone. So the doctor, the expert, is actually the person who has these different options for treatments compared to what the individual has that helped them in their particular case. So that's why I'm always so happy when I see doctors joining our community, because I know we can talk and we could actually spread the information, not the rumors. We could spread, educate people rather than participate in the conversations between amateurs. So, as I said, I'm glad you are here. And talking about those, you said about your practice, and we spoke with you about it in the past. We just didn't have a recording of this. Um, what is that different way of treating? It's not an insurance, right? It's something else.
Yeah, so here in the United States, we've only known one mechanism to treat people, to have people come see us and be treated. And that's usually through insurance. So maybe people pay for private insurance, maybe they get it through their employer, their spouse, maybe they have Medicare, retirement
Mhm.
age, or they have a disability that, they can apply for state Medicaid or Medi-Cal. We have that in California, or Medicare. So there's a lot of different ways in which a doctor gets paid to deliver medical care. That usually works in a place that has an unlimited amount of resources. We're talking about academic institution, big corporate entities, the likes of that. When it comes to private practices like mine, where I literally built the practice from the ground up,
Uh-huh.
I fight. I stuck my name in the ground. I said, I'm here to help. Being able to draw people in with insurance was the natural movement to building my practice. But over time, I found that their compensation rates for a private practice is different for a hospital, for instance.
Mhm.
And it was never sufficient enough to allow me more time with patients. In fact, the longer I stayed with insurance, the shorter periods of time I had with the patient. And so for me, dealing with a lot of complex patients, like those who are on the edge of an amputation, A 7-minute visit is not appropriate.
Yes.
First of all, you got a patient who's coming in who's afraid. They've never heard of the word diabetes before, or they don't understand it, or they don't understand how it pertains to them. And then they don't really even know what's going on with their feet. It's so far from our visual cue. The feet is the last thing people even think about. And then talking about preventive surgeries or salvaging or protecting what's left, that is a conversation that takes hours, not minutes. And so I felt very constrained within the insurance model as a private practice owner.
Mm-hmm.
And because my background is in taking care of complex patients, I really wanted to do this better for patients and for myself and for my community. So, with that comes a cost. Walking away from insurance practices meant I no longer had a volume driven practice. I was no longer seeing hundreds and hundreds of patients anymore. And it comes at a price, right? Because I'm asking
Yes.
patients to now pay me privately to get this higher level of care. But I feel like this higher level of care is what allows people to have autonomy in their health. It
Mm-hmm.
empowers them to understand that there are still doctors out there who want to listen, but if they're constrained, it's really hard to deliver that.
Yes.
And so by not contracting with insurance, patients are paying me privately. They have more of a, I don't want to say concierge as if it's unaffordable, but they really do have this intimate relationship with me one to one.
Mm-hmm.
So if a patient has trouble, let's say getting an imaging order, they can just text me and say, hey, diagnosis code is missing. Can you tell me what it is? Little things like that we think nothing of, but that's how medicine used to be, where the doctor worked with the patient and it was collaborative. But
Yes.
somewhere along the line, medicine became a top down approach where the doctor just gives you the prescriptions, they give you all the things, they tell you things that you're supposed to understand. And then you walk out confused. And this day and age, when we have Google right at our fingertips, patients leave confused. They're going to go to Google, they're going to go to ChatGPT, they're going to go to support networks online, and maybe they get misinformation. And as you were speaking about how everybody, wants to be an authority in these groups because of their own personal experience, I don't want to devalue their own experience, but
Yes.
the nuance in being able to treat hundreds and thousands of patients is so important. And I had somebody who told me they were self-treating themselves with turmeric because, everyone's like, "Oh, turmeric is anti-inflammatory. It's good for
Yes.
you." And they ended up with liver failure
Mm-hmm.
because the toxicity is in the dose. The toxicity is in knowing how much to take and how much not to take, right?
Mm-hmm.
But if you're blindly going online looking for a magic cure, not understanding the nuances of number one, what is even the diagnosis? Number two, what is the appropriate dose? And number three, does that even apply to my physiology? You can cause yourself a
Mm-hmm.
lot of harm. Same
Yes.
thing with Tylenol available over the counter, right? People think that if you can buy it, if it's cheap, that it's safe. And you'll see all the labels say, take it under the doctor's supervision, right? We can
Yes.
only say so much on a label. We can only say so much in a Facebook post. And that's where the nuance is very important. And for somebody who is at risk of foot complications, your risks are going to be different from the next person, from the next
Mm-hmm.
person.
Yes.
So, bringing me back home here, that's why we're here today, to answer all of your questions, because I do dive deep into the nuances because those are the things that are most important. And the only way for me to have time for nuances is to break away from a constrained system that really just puts profits over patients,
Mm-hmm.
right? The more patients you can see, the more procedures you can perform, the more money the institution would receive through the reimbursement.
Yes.
And I really don't want that kind of practice anymore. So for me, it's old school medicine. You just pick up the phone, schedule within the week. We see each other. We go through an hour consultation. I go through the risk plan with you, what your risk factors are, what your options are. I'm not motivated to give you X, Y, or Z. I'm most motivated to educate. If you
Mm-hmm.
have the money, these are the options. If money is a constraint, here is the option. So ultimately, at the end of the day, I feel I feel very honored when patients choose me because that means they're choosing to listen to the expert and they're getting the opportunity to decide for themselves rather than me forcing it on them. They
Yes.
have the autonomy to choose what they want to do with their bodies and their money.
Absolutely. Well, this is a very interesting approach to medical care because I didn't know about it until I spoke with you and a couple other doctors that I know and work with. And I see that more doctors now turning into this approach and leaving the big medical institutions to have their better access to their patient, to have better communication with them, to provide them uh, varieties of treatment plans so people could be participants, not the victims, right?
Right.
Okay.
Mhm.
And with your practice, are you doing you only do this one-on-one in person, or do you have any virtual activities where you could help people who are not in your neighborhood?
I offer virtual visits. So,
Mm-hmm.
initial consultations, if they reside in California and Nevada, that's where I have privileges to provide medical care, which
Uh-huh.
is why you'll see when I try to answer a question, I'm a little bit diplomatic online
Well,
because that's not the place you want to get medical advice.
no, no, no,
That's not the
no.
place to have that
You
discernment,
know, when
right?
I am
But
asking
well,
you, I'm sorry, just to clarify, when I am tagging you on post there, I don't expect you to give people the prescription or diagnosis, but to
right.
to just to have professional a professional's opinion on what to do. I had another doctor podiatrist as well, volunteer. Very often his response was go to your local doctor. This is not
Right.
a question to discuss here in Facebook.
Right. I
So,
understand that you know that. So
mhm,
this is a comment for those people who are seeking for answers.
yes,
Often you'll get there faster with the expert. You'll
yes,
if you don't go straight to the expert, you're kind of wasting time. You're building a library of things that will just ultimately confuse you. And
exactly.
so if people wanted a virtual consultation one-on-one that is available, if they need more guidance, they have you. You
Yes.
know a lot of people. And for podiatrists, you can go straight to our APMA website, which is the American Podiatric Medical Association. So there are podiatrists that you can just look through on a map to see
Hmm.
who is available to you. And I think the most practical thing is to look at your insurance options. You know, you call the number in the back of your card and see who's your local podiatrist. But I don't want to forget the primary care doctor's role in helping you decide too, because we have some very skilled doctors who can
Hmm.
help do things that if you can't get in to see a podiatrist right away, or they just have the added skills to determine, you know, what's going on with your situation, they could probably be a really great resource for you and then decide if it's appropriate to refer you out. So, a practice like mine that doesn't take insurance means you don't need a referral. So, if you
Hmm.
decide to, you know, take control of your health and just take the initiative, you can certainly schedule a consultation online.
Okay, that's a good thing to know. Now, here's a question that we somehow skipped, but can you please tell us again why, for a person with diabetes, is important to have on a short dial or on their telephone list of providers the podiatrist? I mean, if somebody has the I don't know, the eye issues, they probably will have the eye doctor on the top of the list. But when we're talking about the foot health, as you already said, people with diabetes don't think about foot health first thing, but they should, maybe not the first thing, but second and third, that should be the thought. Why?
Well, if you want to stay on your feet, that would be the most practical reason to have a podiatrist on speed dial,
Okay.
right? You don't think about it. You take a wrong step off a curb, a child runs you over with their bike. You have an ingrown nail that you dug out too deep, or maybe you went to pedicurists that dug too deep, right? There's, you know, as we get older, we just get more problems. It's harder to reach our feet. It's harder to see between the toes. And so when you have diabetes, your immune system is also suppressed,
Hmm.
which means you're not able to fight off infections quite as quickly. and then the infection spreads a lot faster. It can happen overnight even. Somebody was out gardening, they got scratched with a thorn, and that can blow out of proportion.
Oh.
So I always tell my patients, here's my cell phone number, text me, email me, use the patient portal, find me on social, like whatever it takes for you to find me and make sure that you get connected. So
Mm-hmm.
established patients get faster access, of course, because we've already gone through their history. I know them very well. I know them year long. I've been in practice for over 7 years, but in my private practice is 7 years old now. And so I've had patients who stayed with me for that long. And it's so easy for them to just email me, hey, I broke a nail. Can I be seen the next day?
Mm-hmm.
Or Dr. T, I felt something unusual. Can you check it out? And so I'll have them take a picture and I can help determine, is this an office problem or do they have to go to the emergency room?
Mm-hmm.
Because it's really, a better question. What happens when you don't have a podiatrist? Well, you make an appointment, you get to be seen 5 months later.
Yes.
Anything can happen within 5 months, right? I've seen infections turn over within 24 hours, landing a patient in the emergency room in the wrong hands of somebody who doesn't know the lower extremity anatomy. They end up having the wrong kind of surgery, and then they're on this path that they probably should have never been on. And I've seen this in a community hospital, mostly because of the volume, but also
Mm-hmm.
because they didn't have the knowledge or the expertise of what to do. And it's great to have access in the emergency room, but sometimes, again, it's the nuance that can help preserve a lot more. Whereas you go to somebody who is just quick to cut, or they just say, it's faster to amputate than to try to salvage. There are still parts in the United States where the treatment is quick, which is usually an amputation of some level.
Oh.
And I've had patients, reach out for a second opinion where a previous doctor wanted to amputate and I was able to preserve it. And so it just really it comes down to having a relationship with a doctor who can advocate for you
Mm-hmm.
rather than waiting for that emergency to come and then you really don't have a choice at that point. It takes a long time to build that kind of relationship with
Yeah.
a podiatrist.
Absolutely. Well, and I probably one of the reasons why people I hear a lot of times, I mean, people who I know personally, and they had issues with their feet health because they stepped on something, but because of neuropathy, they did not feel it. And they only learned later in the day that they apparently damaged some skin on the bottom of their feet. And there's something going on, but they did not know. So that's something that I think that a lot of people kind of don't make a connection. But
Mhm.
this is important, right?
People don't know when they don't have feeling. It's kind of weird. Like we go throughout our day thinking we can feel our body, right? We know when there's a
Yes,
breeze, we know when there's a bug on our neck. Like,
yes.
we feel these subtleties, but when it comes to the feet, we don't pay attention until it really hurts us
Mm-hmm.
because we hobble through it, we wear different shoes. Like we think it just goes away if we ignore it. Neuropathy is tricky because it's slow. It doesn't just change over overnight. So
Uh-huh.
it happens when you have long periods of uncontrolled blood sugars, which then damages the nerves and it damages the small tiny blood vessels that supplies the nerves. So how do people actually feel when they start developing neuropathy? They can say something like, I feel some tingling, or it feels like I'm not really touching my skin. It's kind of like a patient described it like it felt like a wood or a tree stump,
Mm.
but it doesn't connect with them that it might be related to diabetes. We're in a healthcare system where body parts are fragmented, right? You have the specialist of the foot, the specialist of the blood, like we're all chopped up into our body parts. But really it's fully integrated. And as you know, diabetes is a fully integrated body issue
Yes.
in your blood, which supplies your eyes, your heart, your kidneys, and your feet. So with neuropathy, it's tricky. And so that's why a lot of primary care doctors know to check for sensation. Light touch, for example, if they can have a reflex to light touch, that means if they step on something sharp, they can reflexively pull back.
Uh-huh.
But if they can't, then that's problematic. Then we need to be looking at, okay, how good is your sugar control?
Mm-hmm.
Are there other factors? How can we prevent you from accidentally stepping on something sharp? And so we talk about shoes. We talk about wearing shoes in the house. We talk about prescriptions for diabetic shoes for those who might qualify, things like that. So again, it's preventive, right? If there's no urgency, people don't seek it out. And
Uh-huh.
that's the problem is that if you're not proactive, you're reactive, you wait for something to happen, then that's harder to cure. But early on, if you just have a little bit of information, maybe through a first visit with your podiatrist, they'll be able to provide you all of the things to look out for. And of course, I don't want people living like a hypochondriac where everything is a problem, but having some smarts around, okay, I should probably tell my doctor about this
Mm-hmm.
or
Mm-hmm.
not. And oftentimes I have some people who don't know how to utilize the medical system because of those restrictions or because it takes forever to be seen. And so
Yes.
they feel a hesitancy to even reach out to their doctor to say something doesn't feel right because sometimes they feel dismissed even. And I
Uh-huh.
don't blame them.
Mm-hmm.
When they go to a place that's busy and they're like, well, nothing's falling off, so don't worry about it. Like that can feel very dismissive.
Yes.
And so I can understand where patients, if you don't have that relationship with your doctor doesn't understand the little nuances of your medical conditions, can make you feel like, okay, maybe I didn't need to call. But put it on record. If you're a diabetic with foot problem, always call. Always call me at least if you're my patient. I've had to tell patients, and I don't like to lecture, I don't like to scold, but I will challenge them and say, why did you wait? Why did you wait to tell me this? Why was this a surprise? And, they say things like, I didn't want to bother you. And I
Mm-hmm.
say, that's very considerate, but that was a very bad idea.
Yeah.
Please bother me next time. You pay me to bother me. I am
Yeah.
here for you.
Yes.
I
Yes.
don't want it to be end of the road, a phone call from the emergency room, something that was done that was irreversible. That is a terrible thing for me to hear.
Absolutely. Well, this is very, you know, the information that is needed. People have to hear it, and I'm glad that you brought it up because a lot of times when people get diagnosed with diabetes, the only thing they're worried about is what I can eat. And it's extremely important because our food is our fuel. It is important, but the reason why I call my company Smart Move 360 is that you have to look around all. Can you see me? Can you hear me? Oh, I'm frozen. Hello? Okay, we're back. Perfect.
Uh-huh.
So the reason why I'm always calling my company, not always, but I called my company Smart Move 360 because you got to look all around. You cannot focus only on food or cannot focus only on weight loss or only exercises. It's everything. And sometimes small, minor cuts, minor damages, or maybe, I don't know, uncomfortable shoes can cause much bigger problem if you don't pay attention to it. So anything, bodies is a good system that will give us a signal. The important thing is to catch the signal and address it in time, right?
Yeah, listen to your body because it does not get better if you ignore it. It actually gets louder down the road.
Exactly. Well, Dr. Tia, I know that last month you had something online, some event that we even posted in our Facebook group. I don't know how many people had chance to attend it. Is it the once a year, or you have some regular activities that you have for people? Can you talk a little bit about it since we are right about to wrap up, so we need to hear that information.
Last month, I hosted an event to talk about prevention, and it's called Heal My Diabetic Foot Ulcer.
Hmm.
So, there will be a small percentage of people who have diabetes who end up with foot complications, and a smaller percentage of those who end up with a foot ulcer that doesn't heal.
Hmm.
And so, throughout all of those stages, there are opportunities to stop it in its track, to heal it quickly before it ends up on the operating table with an amputation. And so my goal with that was to see who is even interested in learning preventive foot care. And this is a broad topic.
Hmm.
We It's a hard topic because, as I mentioned before, neuropathy is not something that people have urgency for. One day they just feel their feet feeling weird, but that doesn't drive them to see the doctor.
Yeah.
Versus my foot's about to fall off, right? The urgency of that is very different. And the challenge that I've seen is that if people aren't pressed to do something, they're never going to do it. And so I was hoping to see if people were interested in hearing from a podiatrist on the simple things that could be done to
Mhm.
prevent that urgency. And so that was kind of a trial run for me to
Okay.
see who was interested. And so I started off with a few people who were, wanting to hear more, but it's a little bit of a testing area for me to see, is the urgency there to get people interested, or do they just prefer to come in the office? There's a little bit of personalization with that.
Okay.
So that there's a webinar that's available, so I can send you the link if people are interested in understanding what it takes to heal. It's beyond what you need to know. It
Mm-hmm.
really has everything to do with developing habits for you to pay attention. So
Okay.
I can spend all day, I could spend year long talking about what you need to know,
Yes.
but it means nothing if you do nothing about it. Just like you can learn about swimming, you can read all the books, you can watch all the YouTubes on how to swim, but until you get into the water, you develop the discipline to check your feet, to do the work. It's just more junk online. You can go straight to ChatGPT to get your questions answered, right? So that's the difference in the program that I have to offer.
Okay. So you said you have a link for it. So we will put the link in the description of this episode, and anybody who would like to, is it like evergreen or there are some calendar that you have?
Yeah, so this is intended to be a limited time once a year. It is
Mhm.
in depth. It's intended to be 8 weeks long, and
Okay.
so I'll share more information about that. You can at least get on the waiting list or my
Yes.
email list soon. I also have a link for those who wanna learn about the 7 things you need to know about preventing amputations if you have
Hmm.
diabetes, and it's just very straightforward, a two-page PDF on what you need to know at the bare minimum.
All right. Well, whatever links you will give me, I will post them all in description, and this way our listeners will have a chance to investigate what is available for them, because obviously you are in California, and somebody maybe in Virginia will be watching and thinking, darn it, it's way too far to go for a doctor's visit. But maybe some online information that you providing will be helpful for them. All right.
Yeah, and if I can just share one last tidbit about
Yes.
healing diabetic foot ulcers, once they show up, it takes a long time to heal. So that's why prevention is so important. There's a saying that says, what is it? Prevention is cheaper than a cure.
Mm-hmm.
That is so true. And so when patients come to me with like a callus because they have neuropathy, they couldn't feel it, that callus becomes an open sore. Once that sore is open, it takes a very long time for it to heal. And so I'm one of few surgeons out there who do minimally invasive foot surgery to heal these diabetic foot ulcers faster. And so if you know anybody who is dealing with a foot ulcer that's not healing despite having good control of their diabetes, despite having seen the circulation doctor and the blood flow is good, it might be a pressure problem. And a surgery, an office surgery can resolve that and get that to heal a lot faster. So more information if you want to hop into my newsletter, and I'll share all of that information down the road.
Absolutely. Thank you. Thank you very much. Before we saying final goodbye, I wanted to remind everybody who is listening and watching that, first of all, our podcast is posted in this our Facebook group, Diabetes 101 for Beginners. I also post all these episodes in our YouTube channel, Smart Move 360. So if you interested to learn more, please go there, subscribe, and like and share with your friends. This is my attempt to spread the information because this is uh, upsetting to me. I have so many great experts interviews and not enough people seeing it. I think even if you don't have diabetes, but you know of someone who has it, those 30 minutes episodes will get you more educated, and maybe you could share with the person who you care for or that you are worried about, and they will get more motivated to take better care of themselves. So that's something about this Thursday events. I wanted also to remind people that on every other Wednesday in our Facebook group, we have support group meetings where I invite uh, everybody to join us there. And as often as we can, we have some experts joining us there. Usually, more often we have dietitians, nutritionists, but periodically we have life coaches and personal trainers and doctors of different discipline joining us there. As I mentioned already, our podcast is every Thursday on our Facebook group, but on YouTube it's 24/7. You could see it every day, anytime. And this is our YouTube channel. It's called Smart Move 360, but you need to look for Diabetically Speaking with Smart Move 360 podcast. And one more thing I wanted to say, that every last Saturday of the month we have Diabetes 101 for Caregivers event. It's 2 hours crash course where Kim Kyle, our registered dietitian, and myself, we go online and talk about different aspects of life with diabetes, which is important to know not only for person who has diabetes, but person who lives with that person as well. It could be the whatever you eat, however you move, how to select grocery when you go shopping, and how to communicate with each other so everybody is happy and not irritated by each other's behavior. So join us there. But for right now, we are at the end of this podcast. Dr. Tia, thank you very much for being here, for joining me, finally scheduling this and make it happen.
Thank you so much for having me be here. And I appreciate the opportunity to talk about feet anytime. So reach out anytime.
Absolutely. Thank you very much. Well, more to come. I promise I have a lot of activities coming up, so stay in touch. And everybody, have a great rest of your day, rest of your week, and we will see each other next week. Bye bye.